Hello friends, myself Dr. Bhutada, practicing as a dermatologist, cosmetologist, trichologist, laser specialist in Parvani in India since last 20 years. Basically, as all of you know that the epidemic of fungal infection is going on since last 2 years. We are seeing more and more than 30 to 40% of OPD patients of fungal infection. Though there are good medicines available for the fungal infection, though patient is getting relief, but why there is epidemic still continuing and why there is recurrence of fungal infection, this is a big question mark in front of me. My topic is that managing the fungal infection in patient with steroid abuse. As we know that the first line of treatment, whenever a patient gets the fungal infection, he doesn't consult the doctor, he takes the medication by its own and from the medical shops. And many times we use the steroid creams for the fungal infection. After applying the steroid creams, patient gets the symptomatic relief in the fungal infection, but that is a very temporary symptomatic relief. And as soon as he gets the relief, he stops the medication or he continues the medication for long term as he feels better with the steroid cream. But this, in a long-term condition, this indicates in the steroid-induced or a steroid-abuse fungal infection. And once the patient with the steroid abuse comes to the dermatologist, it's very difficult for him to diagnose the fungal infection because the morphology of the fungal infection is totally changed because of the steroid. And most of the common steroid or mixed in creams patient applies the Pandem, Betnavet C, Clop G, and n number of creams. And also by looking the ads in the TV, support lotion and ring guards, all these things. Many times as the ring guards and support lotion is contain the salicylic acid in a higher quantity, patient may get the CID, contact irritant dermatitis on the fungal infection. And this is all abuse of the fungal infection, steroid abuse and salicylic in a higher percentage abuse in the fungal infection. When the patient of steroid abuse comes to you, then you have to properly counsel him that because of this medication you get the symptomatic relief, but you can't treat the disease or can't eliminate the disease completely. So immediately the first thing is that you stop using this steroid or salicylic higher concentration creams to the fungal infection. As soon as he stops, he has to throw that creams in the dustbins, and then he has to start the proper antifungal treatment. And as soon as he stops the steroid creams, then his disease gets exaggerated. Many times patient feels that I am showing to the dermatologist for the proper treatment, I am not getting the relief from the disease because as soon as you stop the steroids, the disease is exaggerated. And this is to be properly counsel the patient that in first 1 week or 2 weeks, 3 weeks, your disease will exaggerate and then that disease will start responding to the proper antifungal treatment. So you should not again start using the steroids for the temporary relief. And after giving proper counseling, then you start the oral antifungal treatment, topical antifungals, and then antifungal soaps and antifungal powder to the patient and give him the appropriate treatment. And once the treatment part is completely over and patient is completely relieved, then ask the patient to use the antifungal soap and antifungal powder for a longer period to prevent the recurrence. So first, ask the patient not to use without consulting dermatologist any cream on the fungal infection, and all fungal infections should be properly diagnosed and they should be treated properly by the dermatologist. I am going to show you a few of the patients which have applied the steroid on their tinea infection and how the lesions appears. So this is the one photograph. Patient was having the fungal infection on the face. Patient has applied the Pandem cream. And after the chronic use of Pandem cream, this is the photograph of Pandem-induced, Pandem-abused tinea infection. Another photo I want to show you. Again, the patient was having fungal infection. He has applied this Clop G, clobetasol gentamicin cream, and he got such type of abuse of the steroid cream. Another photo. Same, the patient was having fungal infection. You can see the flare of areas in between the tinea. This is because of steroid. As soon as you stop the steroid, this infection is going to flare up in a fast way. This is one more picture. A patient has got the acneiform eruption on the fungal infection as he applied the steroid cream on the fungus. So, patient stop using steroid on the fungus, and this steroid-induced fungus infection, it's very difficult to treat as compared to the common fungal infection we get. And as soon as we ask the patient to stop the steroids, initially the lesions flare up and then they settles, and then they respond to the proper antifungal cream